Preterm birth explained, why it happened and how to protect your baby. What if a baby is born before their body is fully ready? Tiny lungs, a fragile heartbeat, and a fight for survival from the very first breath. Every year, millions of babies are born too soon. But why does this happen, and what can parents do to protect their baby? What is preterm birth? In medical terms, this is called preterm birth. It means a baby is born before 37 weeks of pregnancy. A full-term baby develops for about 40 weeks. Those last weeks are critical for lung development, brain growth, organ maturity. When a baby is born early, their body is still in the middle of development. Facts and figures 050 to 120. Here's what global research shows. Around 15 million babies are born prematurely every year. That's about 1 in 10 births worldwide. It is one of the leading causes of death in children under 5. But with proper care, survival rates are improving every year. Why does it happen? There isn't just one cause. But science highlights some major reasons. Mothers' health conditions, high blood pressure, diabetes, infections, pregnancy, factors, twins or multiple babies, placenta, problems, short gap between pregnancies, lifestyle factors, smoking, poor nutrition, high stress, and sometimes it happens without any clear reason. Challenges premature babies face. Because they arrive early, their bodies are not fully ready. They may face breathing problems, difficulty maintaining body temperature, feeding difficulties, sensitive brain development. That's why many premature babies need care in a NICU, neonatal intensive care unit. Hidden issue, hernia in premature babies. There's something many parents don't expect. Premature babies have a higher chance of developing inguinal hernia. What is it? It happens when a small part of the intestine pushes through a weak area in the lower abdomen. You may notice a soft bulge in the groin, more visible when the baby cries. Facts to know: up to 30% of premature babies may develop this. Only 1 to 5% in full-term babies, more common in boys. Why does this happen? Because the baby is born early, muscles are not fully closed. Abdominal wall is weaker. Development is incomplete. This leaves a small opening where tissue can push through. Important for parents, it usually doesn't go away on its own. Doctors may recommend a simple surgery. Early treatment prevents complications. Reassurance, it may sound scary, but it's common. It's treatable. Babies recover quickly. How to care for a premature baby. Because of these challenges, premature babies need extra care. Skin to skin, kangaroo care, stabilizes heartbeat, improves breathing, builds bonding. Breastfeeding, breast milk, acts like natural medicine, boosts immunity, supports brain growth, keep baby warm. Premature babies lose heat quickly. Always keep them warm and covered. Hygiene and protection: wash hands before touching. Avoid crowded places, their immune system is still weak. Regular checkups. Track growth and weight. Follow doctor's advice strictly. A premature baby may start life small, fragile, and vulnerable. But with love, care, and the right support, they can grow into strong, healthy children. Sometimes, the tiniest beginnings create the strongest lives. Do you know someone who had a premature baby? Share your experience below and for more science-based baby care videos.